Hello and welcome to Single Payer Radio. I'm Paul Hoppy, broadcasting on the WFMP 106.5 Forward Radio Community Network in Louisville, Kentucky, where news, information, and entertainment is available 24 hours a day, 7 days a week. The views and opinions expressed on our show are those of the speakers and not the station. Single Payer Radio is a product of Kentuckians for Single Payer Healthcare in conjunction with Physicians for a National Health Program through its Kentucky chapter. We produce this program because we believe healthcare is a human right. We advocate for a national, not for profit, publicly funded single payer healthcare system. Simply explained, it's Medicare for all, only enhanced to cover dental, vision, hearing, and prescriptions, starting at birth and covering everyone. Catch our program at 2 p.m. Monday, 7 a.m. Tuesday, and 11 a.m. on Wednesday. We also stream our show on SoundCloud so you can listen anytime. This radio station relies on volunteers like myself and your ideas and donations to keep us on the air. Today, four members of our group, including myself, discuss the ramifications of the cuts to Medicaid on the health of our fellow Kentuckians, especially in rural areas of the state. So let's get started.
This is Kay Tillow. I'm the chair of Kentuckians for Single Payer Healthcare, and you're listening to Single Payer Radio. We have a program today that is a discussion about the impact of the budget reconciliation bill that was passed by the Congress on July 4, and the concern nationwide and especially here in Kentucky about the impact of that bill, particularly on healthcare, on Medicaid, on people losing their health coverage, and on what happens to rural hospitals. With me today are three wonderful activists in this fight for healthcare for everyone. They are Paul Hoppy and Charlie Casper and Harriet Seiler. All of them are a part of the steering committee of Kentuckians for Single Payer Healthcare. All of them care deeply and know a lot about what's happening with healthcare. So let us begin with this concern about what the budget reconciliation bill signed into law by Trump on July 4 during the summertime. It cuts something close to $1 trillion, I'm not sure that's right, out of the healthcare, and means that millions of people will be kicked off of their healthcare coverage. And I know that Harriet has been involved in work with following, what is going to be the impact on Kentucky. Would you like to speak about that, Harriet?
The Kentucky legislature has put has well, there are two important committees that are, in fact, there are three important committees that are looking at the impact. And one of them is the Medicaid Oversight and Advisory Committee, or board, it might be board, and I call it MOAB. And that's a special statutory committee, a special committee put together, and they are looking only at the Medicaid cuts. And it is and then there's another committee called the Health Services Committee, and it's an interim joint committee. And when the legislature starts in January, it'll become a not interim anymore, just a joint committee. And they have had presenters come, and they are particularly interested in what's going on budget-wise, financially. And it was very interesting to me. The Health Services Committee just in early September had a speaker come from the National committee of state legislators, and this was a staff person, and she did a very good presentation on all the things that are going to happen in Kentucky. And as she spoke, and she was bipartisan, nonpartisan. As she spoke, she referred to all what we call the federal cuts as federal savings, but to us in Kentucky, they're called cuts. Now, I'll pick up on this a little later, but I know the one we're most concerned about are the cuts that might reduce the numbers of Medicaid patients, and that'll have an effect on our rural hospitals. And Kay, I know you know a lot about that.
Well, I'm deeply concerned about that because Kentucky is perhaps the state with the most rural hospitals that are threatened with closure as a result of this Budget Reconciliation Act that makes all of these cuts. And we have 35 hospitals that are on the list done by the Research Institute in North Carolina that are endangered of closing once these cuts begin to click in. So that's one of the problems that is extremely important to us. 35 hospitals shutting down. They include the hospital in Berea, the one in Moorhead. They include many of the Appalachian regional hospitals that are in deep eastern Kentucky. And such closings will be catastrophic for the people of Kentucky, because if you're not within the distance of a hospital, you can't get the care. It will cause major problems and denial of care for huge numbers of people within our state. So that's...
And Kay, excuse me, and doesn't it really impact those rural communities?
Yes, I mean, we know that, in a small town, the hospital in that town is a matter of pride and a matter of the economy. It supports a number of jobs around the hospital. It makes it possible for them to attract some form of economy that works for the town. If the hospital closes, it impacts the ability to maintain any kind of an economy within a small town. I know I think it was the mayor of what is it, Williamson in West Virginia says, when your hospital closes, it destroys the economy of the town. And so anyway, that's a big part of the problem. Part of it is the impact on the individuals who will lose their health care. And the other part of it is the impact on the infrastructure, having the hospitals and the doctors and the ability to deliver care in all parts of the state.
Well, to me, the bottom line is that the 50 billion is inadequate from the start. And there's 1,800 apparently hospitals that are nationwide. And you spread that number over 50 billion, and there is no way. And add to that,
Charlie, excuse me, is that 50 billion is supposed to, in HR1 in the bill, that 50 billion is dedicated supposedly to help the rural hospitals?
Yes, that's the intent. And then of course, on top of that, you've got the 900 plus billion in Medicaid cuts that are on the docket right now. There's some talk within Congress that a group of people might try to lessen that, but it's still going to have a huge impact. And but the you basically talk about the 50 billion, but on top of the cut, that's going to be barely enough to sustain and keep those hospitals open. So there's got to be something going on within Congress to modify that. I haven't heard anything lately. They're being very quiet about it, but it's going to have a huge impact, as you said, Harriet, not just on people getting care, but the communities. The people will be there's unemployment would go up, and a lot of other things would be a problem. So,
And I mean, it's sort of like, what's that old thing? Paying Peter to take from Paul, or whatever that expression is. Um, I think Senator Sanders has said that this 15 billion is just a drop in the bucket. There is no way that it's going to serve all the threatened hospitals. And on top of that, well, I don't mean to sound like Miss Smarty, but I did find out in this Moab meeting um, that the head of our Kentucky cabinet on Health and Human Services, Dr. Stack, got up and testified, I guess, for the Moab committee. And he said that, first of all, the state has to apply for the 50 billion, and it comes in $10 billion increments over 5 years, I believe, and that it's competitive, that our state has to compete with every other state. And then when they apply for this, it can't, they have to say how they're going to use it. And they can't use it for ordinary clinical services in the hospitals to treat people and stuff. It has to be something transformative, something innovative and new that they're going to do. Well, they don't like Kentucky anyway because it's an expansion state who allowed more people to come into Medicaid, more younger single people to come into Medicaid, and we have a governor who's a Democrat, and so Kentucky is going to be competing with all the other states to get this money. And so I'm not very hopeful that we're going to kind of win the lottery, as you might say, when it comes to this 50 billion, which, of course, our current president has bragged about. It sounds so generous.
The 50 billion was put into the bill, the Budget Reconciliation Act of 2025, and which is called by some the One Big Beautiful Bill, and by others it's called the One Big Ugly Bill. But I think everyone knows what we are talking about. It's the bill that makes so many cuts. In addition to giving tremendous tax breaks to the very wealthy, it cuts into our health care in a way that is truly catastrophic. In Kentucky, with so many people on Medicaid and so many hospitals at risk, one of the problems we face is that they have put out rules that say that half of this 50 billion for the rural hospitals will be distributed equally to the states. That means that with states that have no hospitals at risk, we'll be competing and we'll get about the same amount of money, at least out of part of that. So it really is a totally unjust and unfair way of doing it. In addition, the bill puts into the regulations for being eligible for Medicaid a lot of requirements, work requirements. And of course, they pretend that those work requirements, they just make it fair. Everybody should be working and getting a job. The reality is, we have seen from the experiments in Arkansas and other states that the ability to stay on top of the reporting mechanisms will be so difficult that even people who are working are not going to be able to hang on to their Medicaid because the reporting requirements are going to be knocking them off. And that indeed is the intent of the bill, is to cut down the rolls because, those who think in that manner think that it's a terrible thing that people have gotten coverage. Paul?
Yeah, as far as the dispersion of the fund, as you just said, 50% will be equally divided. As far as the other 50%, the funds will be split by percent of population in rural census tracts, the number and proportion of rural health facilities, situation of hospitals serving disproportionate share of uninsured or low-income patients, the amount of uncompensated care and relevant state initiatives, and progress on policy adoption, including Make America Healthy Again provisions. So it's pretty complicated. And again, this money, the whole 50 billion will only go to states who have been approved to participate, which again, there's another laundry list of requirements in order to be approved to receive any money at all.
Well, and I forgot to mention that, Paul. Thanks for picking up on that. When Dr. Stack talked about the 50 billion and the competition, he said that we are eligible in Kentucky because we have sufficient rurality. That's a hard word to say, sufficient rurality. And I'm sure there are some states that have hardly any rural hospitals, as Kay said. And then can we go back to the work requirement? I mean, in Kentucky, that is one of the waivers, I think. And there are these other waivers. And a couple of weeks ago, I was in Frankfurt at one of these committee meetings. And at the end of the meeting, a young mother came to speak, to testify, and her daughter's health, or because of her daughter suffers from autism, and apparently she was eligible for care at home according to the Michelle B waiver. Michelle B, I think, and with which a therapist, a behavioral health therapist, mental health therapist, could come to the house and help her 12-year-old daughter sleep. I mean, she said it's one thing to have a baby that keeps you up all night, cannot sleep, but when you have a 12-year-old daughter who cannot sleep, the importance of this therapy or therapist coming to the house was so important. And I think we have a lot of waivers in Medicaid that provide for therapists or various kinds of help or support so that people can stay in their homes. So there's so much in Medicaid, and now I am not up to date on whether or not there are cuts to the waivers. The only one I know about is the work requirements. And a lot of the people that look as if they're not working really are maybe caring for an elderly family member or a family member that's not well. They're caring for them at home, or they are working part-time. And of course, if you're working part-time, all of a sudden your hours can be cut or your hours can be increased, and then proving that you're working can be difficult, or you get involved in, what do they call that? There's a word, churn, where you're eligible for Medicaid one week and the next week you're not. And of course, the new requirement from this new bill is that they don't just have to recertify once a year now, they're going to make them do it every 6 months. And we're going to lose people. We're going to lose people because of technology or because of this, what, the churn in satisfying the work requirements. Help me out here, guys.
Well, yeah, I've got some help. I mean, just as the basic fact that administration is costs are going to rise drastically to do this on a monthly basis rather than once a year. That again, there's money that's being taken out of treating sick people. It's just we view it, us advocates, as criminal and cruel, and that's what it is.
I remember when Kentucky, began getting onto the rolls of Medicaid. I believe it was about 400,000 people that were added to the Medicaid rolls as a result of the Affordable Care Act. And that opened up healthcare for many, many of our people. And here I am touting how we can't lose Medicaid. I'm the one who thinks Medicaid is a poor program for poor people. It's unequal, it's unfair. It has many problems before this problem, where people were not able to see specialists. It pays less to the doctors and to the hospitals than the other programs. So it's a way of saying these lives are not as important. And yet here we are, when it will be taken away, it will make it worse. But so as we fight to try to stop it from being taken away and to try to save the rural hospitals, we also work to get our message out that we have to fix this healthcare system. This is one of the problems with it, that there's always a continued crisis that makes it worse and worse and worse. And yet,
Right. Well, Kay, excuse me. I can remember how you said that our healthcare system right now divides us into these tiers according to wealth or according to health status or I mean, and of course, we want everybody covered, and we want everybody covered with a publicly funded program. But for now, today, we're talking about the needs for people to become aware that we need at least this short-term fix to Medicaid. Would you agree? In the short term.
I'm absolutely in favor of reversing those cuts and
Right.
reversing the threat. But I think that we have to begin to lay out for the people of this country how bad the healthcare system is. We pay double per person what other industrialized countries pay, and we come in at the bottom. The Commonwealth Fund says we have a failing healthcare system. It's worse in terms of life expectancy. We live 5-6 years less than those countries who have better healthcare systems. It leaves people out. We still, after the Affordable Care Act, we have 28 or 30 million without any coverage at all, which causes chaos in their lives and unnecessary suffering and death. And we're going to have another 15 million without coverage as a result of this. But even those who have coverage can't afford their care. So we have 100 million people in our country who have medical debt. And that's why we have a project to say, let's save the rural hospitals by enacting a national single payer system. Because what that would do is, instead of leaving those hospitals dependent on the number of private paying patients that they have, or dependent on a Medicaid program, all of the hospitals would be funded for their operating costs through the publicly funded system. So we would maintain an infrastructure that would serve the people of every area of the country. And that's what we'd like to do, is to make a breakthrough in the thinking that we need a publicly funded healthcare system in these rural areas to save these hospitals and for all of us to cover all of our people and to keep us out of this constant crisis and catastrophe that we face as they cut even from this sparse healthcare system that we have.
Yeah, you're such an eloquent speaker for this, and I never get tired of hearing you say these wonderful words. And again, that's what our whole group is about, Kentuckians for Single Payer Healthcare. We're the single payer being the government who pays out of the trust fund that we all pay into. It's pretty simple, it's pretty basic. But the fact that capitalism, pure capitalism, doesn't really allow for that is probably that's the root cause of all these discussions, all these battles that take place, all these demonstrations that we go to. Very simply, if we could take the profit out of our healthcare, we
Right.
can
Remove
compete
the
with all
profit.
the other industrialized countries in the world that provide this for their citizens.
Absolutely. That's what we have to do. And we have to say to those people in Congress that don't say it can't be done. You're there. This has been done in countries all over the world. It has majority support. It's a popular political position. And improved Medicare for all has something like 60% of the population. So you're going to win votes. You're not going to win more money from the insurance industry, but you don't need that money. You need to be responsible to the people of the country and to their needs and to the people who have the votes rather than the people who have the money. And that's what we're working to do. These rural hospitals that are endangered are in the congressional districts where there's no support by the congressional representatives for a national single payer, improved Medicare for all system. They should be the first ones to step up to protect the citizens of their areas. And that's what we're hoping to do, is to build an understanding within rural America, all across the country, that the salvation of these hospitals and the maintenance of an infrastructure of healthcare and the coverage of people in the rural areas is dependent upon passing an improved Medicare for all, removing the profit motive from healthcare. There's something wrong with saying that we're going to put people who have a profit motive into the decision-making roles within the healthcare system. That's just not right. It means that
Right.
those companies can improve their profit with the denial of care. And that's exactly what they do.
Well, that's what's happening now with prior authorization. We have delays. A delay in treatment can end up meaning a death if you've been delayed when you needed the care, life-saving care. And just the one thing I want to say is the public somehow thinks, oh, if the government's running our health care, it'll be terrible. That old thing, if the government says they're here to help, that is a message of disaster. That's not what we want. We want the government to finance health care the way and run the funding the way they do for the Department of transportation, although they could improve that too. Or even the Pentagon is paid for by government money, by taxpayers and fire departments, etc. And we have this essential need for health care, and our government, our taxpayers, our tax dollars should be going to provide that for everybody. And I appeal to all the people listening, all to find out more about how other countries do it and do it for much less, and they cover all their people. Nobody ever gets turned away. I mean, there may be a very small little copay, but I mean, really and truly, well, everybody can hear my accent. I'm originally Canadian, so I know it works.
And of course, one of the elements that I like the best is including everyone in Congress and the president under the Medicare for All.
Right.
That it will ensure that the adequate funding is there. You don't have to ever worry about it because they're going to be covered in the same health insurance coverage that we are.
Yes.
And I think that everyone in the United States would applaud that so that Congress doesn't have its own blue ribbon coverage and that they're part of the same thing that we have. They'll see the same doctors and stuff. That they won't have to worry about that, but they just don't have their own top-notch coverage. And that should be part of the equation as well.
Right. You're right, Charlie.
That's right. You put us all in the same basket, then we all have an interest in maintaining a high quality system.
Yeah.
It's not that there's a separate designation for the disabled and those of lesser means. That's what we have with Medicaid. That's a part of why we have to keep fighting for it, because the people that are covered by it don't have a lot of power and a very big voice. And we're having a big problem with making democracy work within our country. So we have to fight for those folks, but we fight for all of us, whether you're on Medicare or in Medicare Advantage or in an employer-based plan or wherever you are within this system. Quite frankly, you're not secure. There are things that can happen with your plan that mostly being unable to afford it. The costs for the premiums are going to be going sky high in this coming period of time. If you're on Medicare Advantage, you're threatened with denials and delays through prior authorization. If you're on traditional Medicare, there are people that are trying to put prior authorization into traditional Medicare. And many on traditional Medicare still have the costs of the Medigap plan and the dental and the eyeglasses and the drug plans that are very, very expensive. So Medicare isn't as good as it needs to be. And it doesn't.
Well, and I visited one of my own doctors this morning, and he said they never should have allowed Medicare, traditional Medicare, to be privatized. And that's what they did with Medicare Advantage. And he was in a little rant this morning saying that when he gets reimbursed for seeing a patient, a Medicare patient, if that patient has a Medicare Advantage plan, he is reimbursed half of what he is reimbursed by traditional Medicare. And so Medicare Advantage is not only ripping off seniors who get duped by that advertising, Medicare Advantage is ripping off physicians and even hospitals because the reimbursement is lower. And well, anyway, I can't say enough enough negative things about Medicare Advantage. And unfortunately, in Kentucky, our state retirees and our teachers are trapped in Medicare Advantage plans, and they can be subject to denials. They maybe not at first, and maybe not when they're younger, but as they get older and maybe have chronic illnesses, and they need more care or more expensive care or they need to be in rehab, all of a sudden, bang, up comes the Medicare Advantage denial or the delay.
Absolutely. And the other thing that we might mention here is the fact that pretty soon, starting in October, is going to be the new renewal period for everybody's healthcare insurance. And we're being told that expect drastic increases in the cost of these premiums. So the sticker shock is going to hit at the end of this year. And there's going to be changes in these freebies that are given out because the Medicare Advantage companies are actually losing money. They're not doing well at all, cheating us as they already are, and cheating our government out of funds. So what can they do except raise their premiums? It's a vicious cycle. Again, I'll use the term it's cruel to sick people, and that's why we have to get profit out of our health care.
Right.
The Medicare Advantage plans cost us, our Medicare Trust Fund, I think about 20% more than it costs for a person who is in traditional Medicare. I think the MedPAC Advisory Board told us that we paid in a recent year $84 billion in overpayments to the Medicare Advantage private companies for covering people than we would have if those people had been in traditional Medicare. And of course, in return for their services, our people get hit with narrow networks. They have difficulty finding the doctors and the hospitals. Every few months, we get another blast that, some contract with Medicare Advantage and some hospital system isn't working, and they're going to be kicked off of that, or you're not going to be able to see your doctor. We need to get away from the control that private insurance has over our lives. It is amazing the extent to which many, many people live in stress and fear and stay in jobs that they hate because of the health insurance, are not free to move. It's an attack on our freedom that we don't have the ability to have a good national single payer, free from profit healthcare system that allows all of us to take advantage of what we as a nation have developed in our ability to deal with chronic diseases and other diseases.
People thought that the ACA, and some people call it Obamacare, that was a wonderful program, but you've already mentioned, Kay, that it left millions still uninsured, and there are people who think, oh, well, I don't want all those illegals to be covered. They're not covered. And they're not covered. They're not getting Medicaid either. It's just such a harsh thing to say. We would want, anyone new to this country who has to live and work here should be covered as well. Well, and in all those other countries, and Canada, for example, if you're an official resident of the country, you're covered. But anyway, we need to get our message out. Okay, we want Medicare without the need for a supplement, and we want it free from profit, and then you'd never get a bill in the mail, and you'd never get people wouldn't be going bankrupt because of medical debt. Um, and you'd have choice of doctor, choice of hospital. You wouldn't get those surprise bills because you didn't realize the anesthesiologist was out of network or something. Okay, well now I'm on a bit of a rant. But I want to stress again that it works. The Canadians are like us in that they need more doctors in remote areas. but wherever there are doctors, etc., all the members of my family have had wonderful care, never been turned down, and never get a bill in the mail. And if they pay a little more in taxes, they may pay a little more in taxes, but they get something for their taxes. I mean, we pay the taxes and we are paying high taxes as it is, and we aren't getting health care.
Yes, but we are going to be getting a beautiful ballroom attached to our seat of government.
Seat of government is kind of a hot word maybe we shouldn't use because we're nonpartisan. But I mean, we're nonpartisan, but we care about this issue. And all our fellow uh, Americans and people in this country, we all need to be making it known that we want everybody covered.
I'd like to make another comment about healthcare and Medicare for all, about the bills that have been introduced going all the way back to 2003. And probably Kay knows more about this than the rest of us. But in terms of these bills, they have always been introduced by one party. It's never been a coordinated effort between the two parties. It's always one party. And as far as I know, there have been no persons from the other party that have ever co-signed any of these bills. Is that correct, Kay?
So far as I know, I think that's true.
But now
So
the original Medicare bill that created Medicare back in 1964, didn't that pass with a bipartisan initiative under
I don't know
Johnson?
the answer to that. I think that at that point, Johnson was elected with a landslide. So I think there was a huge majority Democratic. Whether the Republicans voted for it, I don't know. Maybe they did.
Well, I mean, sort of even, I think even, well, they probably weren't for-profit insurers, but even the insurers wanted Medicare because, well, no, I'm mixed up here. But there were an awful lot of people who wanted seniors and elderly parents covered, and they supported the bill for
And
that.
the opposition from the insurance industry wasn't so great for just seniors because at that point, they didn't want to cover those people. Those
Right.
were more expensive. So the insurance industry didn't fight as hard as they're fighting now to stop us from being able to remove them from a healthcare system so that it serves us instead of them.
Right.
I think ironically, the biggest opposition came from the American Medical Association.
Oh, right, right.
Yes,
Because
that's
they thought it was socialism. And I
Right.
mean, this is not socialism or any ism. This is just plain common sense. We cannot leave our people dying without care, suffering and dying without care. Kay, can you remind us again how single payer will help the rural hospitals in Kentucky?
sure. Sure. Now our hospitals are paid by the private insurance or the Medicare or the Medicaid that they have. So hospitals in very wealthy areas that have a lot of privately insured patients can have tons of money and be building the Gold Coast for the wealthy patients. And hospitals located in areas where people don't have that private insurance, more people are on Medicare and Medicaid, and they're underinsured people, they are dependent on that payment from those insurance companies and they don't get enough. What single payer will do is finance the hospitals, the nursing homes, the infrastructure so that whatever we need to make sure everyone has access, will be financed through the system. And we don't have to worry about hospitals closing down, because so long as there are patients who need that hospital, there should be a hospital within some decent period of time to get access for everybody in the country. And, it costs a little more to keep them in the rural areas, but everybody has a right to them. Other countries have rural areas. They keep health care in those areas as well, and we can too. And single payer plans, as introduced into our Congress, would pay the operating costs for the hospitals and nursing homes so that they would be able to function and not be endangered with the closing that we now face. And the closing of these hospitals isn't really new. It's just worse with this. A year ago, before this was even thought of, we were talking about 700 hospitals at risk of closing and hundreds that have closed down. We have healthcare deserts in our country, particularly for labor and delivery, where
for maternity, right?
Right, where they can no longer maintain that service, so that people are a long way from access to labor and delivery, which causes, there's a story, you find it in the papers, about someone driving the husband driving at 100 miles an hour to get to the hospital that's an hour away, and disasters are happening. So we have to have a system that works for us and works for all of us, with everybody covered for all medically necessary care, include the dental, the eyeglasses, the hearing, all of the things, the mental health, the nursing homes, long-term care, whatever is needed, cover us all, save the money by removing the administrative costs that are caused by the profit-making industry that currently controls our healthcare. Well, and have a good system and a much better country. I think we could do something about the hostility that we have in this country if we had a healthcare system where we take care of each other. I think the passage of that bill would do much to transform the nation into a better society and a better place.
Well, and I'm glad you mentioned long-term care and nursing homes. People in Kentucky, unless you have a family member involved, they don't understand that in a lot of these rural communities, well, all across the state, there are a ton of people, and at some point I used to have the number, but the number of people, of senior citizens covered in long-term care, covered by Medicaid. So that's another cut that is just, these are just unbelievable. And you think, how can we as a nation be allowing it?
And of course, the funding for single payer would be less than what people are paying today by an extremely large amount. And that point has to be understood. It'll be a simple tax. Retired people won't pay it. There'll be other methods of getting money on stocks and bond trades and capital gains, but it's going to cost the majority of citizens in this country substantially less than what they're paying right now. And as Paul said earlier, when the insurance companies start creating huge increases starting in the fall here, we're going to get a real firsthand reality check on where we're coming from.
Right. And people, now I know with the ACA, there are, I do know people who couldn't get any kind of insurance until the ACA came along. They had a pre-existing condition or something. So the ACA did help some people. However, it's a big deal and a big profit source for the private insurers. People forget all those marketplace silver and gold plans, etc. They are run by private insurers who profit from it. And then the deductibles can be high. And I've forgotten, I used to know how much, the ACA, I'm not sure of the role with families, but a lot of families are paying enormous premiums to have health insurance.
And now the deductibles are really huge. And that's another thing that is happening now as we speak, is that there are certain subsidies so that a larger number of people could get into the exchanges and get coverage. And those subsidies, of course, go to the insurance industry. But
Right.
those subsidies were put into effect, I think, during the COVID period, so that more people would have coverage at a time when we were in a different crisis. And those subsidies are now running out. Unless Congress takes action, those subsidies will run out, and that will probably result in another 5 million people who will be kicked off of their coverage, unable to afford the premiums if they are not subsidized.
Right, and there's a tax credit too that people will lose. In fact, you hear the politicians on you hear the Democrat politicians saying the tax credits must be saved.
Yeah, that was another piece of what was happening with the hospitals. One of the things that Kentucky and most states have done is to use a provider tax to be able to draw additional federal funds to
Right.
support the hospitals within the state. That's being impacted by the Budget Reconciliation Act. That HR1 is taking away or reducing that ability to do that tax as a way of subsidizing hospitals. So that's another way in which the hospitals are being hurt by this bill.
Right, and they claim that that really will hurt them. I did hear a representative of the Kentucky Hospital Association saying that it would take away their ability to do certain kinds of programs or treatments. And it's interesting. Apparently, I'm mixed up now. One of them, they liked the House bill, but then it got cut out of the Senate bill. There's a difference anyway in the impact of on the provider tax between the House and the Senate bills. And I'm sorry, I don't know that. But now, Kay or Paul or Charlie, what do you suggest people around Kentucky who are listening to us? What can they do now?
Well, of course, people can go to kyhealthcare.org. It's a website that we as an organization maintain to try to make contact with the public and to keep people informed about current issues and to make sure people have access to read about and learn and study what would a national single payer system do. A national improved Medicare for all people. There's a link there where you can read the legislation that is currently in the Congress, and you can get in touch with us and get our email. We meet twice a month and by Zoom, and we would love to have you join us. We need lots more people to help take this message all over the state. We're planning to travel to different places within the state within the coming months, and we would love to have you be a part of our effort to do outreach and education and advocacy to win our state and our nation to the support that is so strong that we force a reluctant Congress to pass a necessary bill and give us a national single payer healthcare system. kyhealthcare.org.
Well, and there's a good link there, isn't there, with the Physicians for a National Health Program that explains the details of how a single payer.
Right. We are affiliated with Physicians for a National Health Program, Kentucky, and that national organization, PNHP, has done much of the research over the years that has formulated the plans for this system and actually was the basis of the legislation that is currently in Congress. So you can find all the articles there and the explanations and the facts and learn the truth. Truth is hard to find these days because we live in difficult times and challenges to our democracy. But the access that you have on our website will take you to the truth. We have no financial interest in this at all. We're just ordinary people like you looking to try to play a role in making our country and our state a better place.
Well, and it's probably worth a call or an email to your member of Congress as well.
That would be good. We're trying.
I mean, just saying that we must do better. Our people deserve better, and we need a national single payer program that covers everybody. I mean, even if you know they don't agree, it's still worth it to make the call or write the email.
That's right. I even heard at a rally recently a former congressperson from our state who said, when we passed the Affordable Care Act, we should have aimed higher and instead passed an improved Medicare for all. That is true. We cannot fix the Affordable Care Act into a system that works for all of us. The insurance company profits are in the way of setting that system up in a way that it can actually serve all of the people in our country and get out of the way of the doctors who, we're suffering from burnout from the physicians because they are in many cases unable to get the care needed for their patients because of the prior authorization that vetoes their decision.
I have also a tip for what can we do, and to a large degree in these times that we're in right now, stay off of network news. Don't watch Fox News. Don't watch CNN. Don't watch MSNBC. Go to the most wonderful thing, the most wonderful invention of the 20th and 21st century, which is YouTube, and start searching for the truth. It's not going to come right to you, but do a little research. Be curious, and you'll find out a lot of things are happening that you don't really like about our country and our government.
Well, and if you do want to see what Kentucky State Legislature is doing in these committee meetings that they're having about Medicaid, they're also on YouTube.
You've been listening to Single Payer Radio, brought to you by Kentuckians for Single Payer Healthcare. We thank you for listening.